Today on Beyond the Image, I'm sitting down with Ashley Hoban, Chief Ultrasound Technologist for Steinberg Diagnostic. We're going to talk about all things ultrasound and what are some of the unique procedures that they do that you may not be aware of. Hi, Ashley. Thank you for joining me.
Hi, Danielle. Thanks for having me.
Let's start by telling our audience your background and what led you to ultrasound and ultimately your position now with Steinberg.
My passion for healthcare started when I was a little girl. When I was a child, I needed to have some pretty serious back surgery. And within my hospital stay and even the imaging leading up to the diagnosis, those people, even though I may not remember their names, but every person had an impact on me. And so I kind of knew early on I wanted to go into medicine, just didn't know what field. My sister was the one who kind of brought it upon, hey, my friend's going to school for ultrasound. I thought, that's interesting, because I also love doing CSI. Like crime scene investigation was also a passion of mine. I thought, well, this is kind of the better of two worlds, where you're investigating and you're also helping people. So that was 16 years ago, or actually 18 years ago now. I've been doing ultrasound for 16 years at this point. So that's how I got into it. That was back in New York. We moved out to Las Vegas, 13 years ago now. I started at a community hospital here in town, and pretty early on felt like it just wasn't my home. It just didn't feel right. And when I came and interviewed for SDMI, it was like within the first couple of weeks, I just felt like, okay, this is it. This is my home. And I've been here ever since.
What do you think it is about SDMI that is different than other practices?
Many things. On an employee level, I'm gonna say it's the amount that they give back to us. Also, the team environment that we have is awesome. We have a wonderful group of technologists, administrators that just really go above and beyond to kind of create that camaraderie. And as we have grown, I still feel like we have that sense, which is awesome. We have great technology that they're continuously investing in, which in my field of work is a blessing. You don't really see that very often, where people are willing to give you the best of the best to be able to diagnose things and see things the clearest. So that's really nice as well.
So I think that a lot of people think ultrasound and they think babies.
Mm-hmm. Yeah.
What else are you guys doing outside of obstetric scans?
We can look at basically every part of the body. Blood vessels, any artery, vein in your body. We interrogate to look for any disease. Your organs as well, liver, gallbladder, kidneys, spleen, uterus, ovaries. We evaluate all of them to look for pathology that could be, a reason to the patient's symptoms, as well as breast imaging is a big one here at SDMI, because we work very closely with the mammogram department to help full circle any type of pathology they may be seeing on the mammogram. We kind of help give the radiologist the visual of what it looks like that can help determine if a patient requires biopsy.
And so speaking of biopsy, tell us about some of the different biopsies that you're doing within ultrasound, because I think that's something that a lot of people don't necessarily innately realize is a function of the ultrasound department.
Yeah, we do biopsies at almost all of our locations. The ones we perform the most are going to be our thyroid biopsies, breast biopsies. We have paracentesis or thoracentesis, where we drain fluid. We can biopsy lymph nodes. I would say those are going to be the most common ones that we perform here.
How have you seen the technology change over the last decade?
Wow, yeah, a lot. Yeah, when I started my career, the machines were very grainy. You could see pathology if it was obvious, but now you can see pathology even if it's not obvious. You can see, distortion in the surrounding tissue just because of the high resolution that we now have with ultrasound probes that we did not have 15, 20 years ago. So it has come a long way, and it just continues to improve. And we have some of the best technology that's out there, which is amazing.
How can a patient that needs to have an ultrasound done make sure that the facility that they're going to has the best technology, that they're getting the best images possible?
If you do your homework, you're going to want to know, how old is the system? Is it a reputable ultrasound manufacturer? We use Canon, GE, they're great. They're very reputable, very well known, and been in the field for a long time.
If a patient were to call and kind of ask those investigative questions, is that something that they're going to be able to get answered from a frontline call center employee?
Most likely not. They will require a bit more investigating, I think, on the call center's part to reach out to the head of the department and get that information for them.
What other kinds of questions do you get from call center that they're asking you that are coming from patients?
What to expect during a procedure is a big one. People are apprehensive. We do have Google now, and people can look things up, but I think a lot of people still want to hear from us. What are they gonna expect to happen? Is it gonna be painful? And we do our best to reassure them, we are going to make sure they don't feel anything, and give them all the details and answer any questions they have to ease their mind.
So what can a patient expect? What is that experience going to be like?
Yeah, so during a procedure, the technologist is going to bring the patient into the room. They are going to explain to the patient what type of procedure they're there for, confirm site location, and then explain to the patient the details of the whichever type of biopsy they're here for. All of them are going to start with cleaning and numbing, and the numbing medication is going to be what kind of relieves that pain for people during the procedure. Our doctors are exceptional at procedures. They're quick, and they do a really good job at comforting the patients to make sure that they don't feel pain during the procedures.
What is recovery like from a biopsy?
It's going to depend on the size of the needle. So, breast biopsies may take a little bit longer to recover from, just because the size of the tissue they have to take in order to come up with that diagnosis is going to be quite a bit more than an FNA or a thyroid biopsy. For a thyroid biopsy, you're going to expect a little bit of tenderness and swelling for a couple days, a bruise at the site, but you can really go back to normal activity following day. For breast biopsies, you may have a bit more of a recovery. It might be a bit more longer, more bruising, more swelling at the site, and that's to be expected.
What kinds of things are being diagnosed through ultrasound? You talked about, being able to ultrasound veins and things like that. Yeah. What are you looking for specifically?
Yeah, so when we're looking at veins and arteries, we're looking for either peripheral vascular disease or blood clots. We definitely have seen a rise in blood clots over the past couple of years, and so that is something that patients are coming in quite often to evaluate, either to follow up on blood clots to see if it's gotten better, worse, or stayed the same, or to see if it's a newly diagnosed blood clot. Intra-abdominally, we're looking for masses, kidney stones, liver disease, any type of fatty liver, cirrhosis, and then, for gynecological issues, we're looking for anything ovarian cysts, or even checking the placement of, IUDs. So it can be a broad range of things. We also have a really great program here for pediatrics, where we see a lot of peds patients. And that is something I am very passionate about, because I feel like I can relate to them in a way, since I was a child going through some medical, and being able to provide, infant hips, spines, pylorics at an outpatient facility is very helpful for patients, so they don't have to go into a hospital to get that care.
How do you prioritize patient care and patient experience?
Yeah, it's number one for sure. You know, I feel like I'm always trying to, you know, if a problem arises where a patient was scheduled for the wrong procedure, I am going to get that patient seen and minimize, you know, their disruption to their care. You know, if we need clarification on a referral, I will call the doctor's office myself and I will say, hey, we need to find out what you need, you know, because the XYZ is not making sense. We want to confirm we're doing the right, you know, patient. And that is number one for us, is to make sure that patients are always taken care of and that they feel, even when things don't go right, that they're being heard, and that we're listening to them and fixing whatever, you know, concerns they're having.
How do you instill that patient experience is number one into your team? How do you make sure that they have that same mentality?
I try to just lead by example. I try to, you know, because these situations will arise at each location separately or simultaneously, you never know. And I, you know, the last thing I want to do is say no. And so I explain that to my team members as well, like, listen, we need to do right by the patient and it may put us a little bit behind, but we need to make sure. And at the end of the day, they understand that and they see that, you know, after I have the conversation with them, like, we need to make sure we take care of that. And truly, that's all I try to do, is just lead by example and always try to do what's right for the patients.
How do you feel the organization supports you in putting patient care at the forefront?
Oh, it's very easy. I mean, if anything, I learned it from them. So, I mean, it's in no question or doubt, they are there to support you 100%, and whatever decision you make, you know, I have a great support system for sure.
What is your most common patient complaint?
I think a lot, I don't know if it's one complaint in particular or if it's maybe just a misunderstanding of ultrasound or how ultrasound works that maybe is kind of the root cause of some concerns. The technologist didn't put the probe where my problem is. I would say that's a pretty common one we get. And for different exams, I'll just use gynecological, the bladder. We need a bladder nice and full in order to see uterus and ovaries. And so we utilize that bladder as, it's called an acoustic window. It allows our sound beams to travel through and allows us to see things lateral to it and below it. And so I think sometimes, you know, we may not be right over the area of pain, but we are looking at the organs in that area just using the acoustic window. So I would say that is probably a common one we do get. And once I chat with the patient and kind of explain that to them, they're like, oh, okay, I get it. Yeah. So yeah, I would say that's number one.
What advice could you give to somebody who is considering going into ultrasound as a career path?
Do it. It's very rewarding. I would recommend doing your research on the school you choose. We do see a lot of fly-by-night schools these days where people are not well prepared when they come out, and they're also not eligible to become registered. All of our techs here at SDMI have to be registered per our ACR accreditation, and they have to be registered through ARDMS. And if you graduate from a fly-by-night school that's not accredited, you're not eligible to sit for an exam unless you've worked one full year. But you can't find anywhere to hire you not registered. So that pains my heart when I see people who went to school, put in the time and effort, and now they can't sit for a board.
How long is the schooling process?
It depends on which program you go to. There's a couple in town. You can do a bachelor's degree at one of the universities here, and there is also an associate's degree at one of the community colleges here. Both excellent programs. We've taken students from both, and we continue to take students from them, you know, to give back, as well as, you know, get the cream of the picking because you get to, you know, really train these students to SDMI quality, and then hope that you can get them on board at the end of it.
How do you think SDMI has impacted the community?
They're a staple. They are a Las Vegas staple. They're the original, radiology center, and we've only gotten better as the years have gone on. So we impact and we take care of tons of patients and help them out in any way we can.
What do you think are some of the other misconceptions about ultrasound?
Is there radiation involved? I do get that question asked a lot, and we don't have any radiation with ultrasound. We use ultrasonic waves. So this is a modality that is safe on pregnant women, on children, and really on anybody. So that would be the number one misconception I think people have, is that we also use radiation, and they are always, is this safe for my baby? Is this safe for me? And just reassuring them that yes, it is. There is no radiation involved. This is the safest route you could go.
So can you tell us one of the stories of one of your most memorable patients?
It was a baby. She had come in through the urgent care, and she was there for hematuria. That was the diagnosis when the rec came over from the ER. When the patient got there with the mother, there was a little bit of a communication barrier. But we did our best to, I did my best to get as much history as I could, and they ordered a kidney ultrasound. We automatically look at the bladder. I took a look and I saw a huge tumor sitting right below the bladder. And this baby was only 6 months old. And so I documented it. I wrote up my report, and I ended up having to, call the ER and say, hey, just take a look at the report, the ER doctor, when it becomes available. And they ended up getting another scan that night. I think a CT was recommended, and it was what was believed to be a malignant tumor in the patient's uterus. And that was heartbreaking to me because, it's a 6-month-old baby, and there's a communication barrier, and, just so much heartache. And me being a mom myself, just broke my heart. So that case has definitely always stuck with me as one that, I hope turned out well for the baby and mom, yeah.
How do you deal with that emotional impact of seeing tough cases?
Oh, I mean, every technologist is going to have moments of tears. Yeah, you find things and it's not always the best, and you do the best you can to just make that patient's experience so flawless, supportive, and hopeful. Yeah, so yeah, I have worked obviously at SDMI for 13 years, and there's not one person on my team that has not had a moment of just pure heartache, right? Because of some of the things we see and we find are not always the best, and you always wonder what happens to them, and you want to see the best, for every person. Do
patients ever come back and follow up?
Yeah, we have had some of those stories where it's oh my gosh, look at you, you're done with your chemo treatments and you're doing great. And those moments are it's all of those moments are why we do what we do. Yeah, is to be able to find those things on patients, because ultrasound is a bit different than other modalities. We are the investigators, and so if we don't see it, we don't take the picture, it doesn't exist. And so there is a sense on our shoulders with that. And so when we're able to really help people, it's that much more personal for us.
How do you handle not being able to tell the patient what you see while you're scanning them?
Yeah. What I do and what I try to have my team do is to be supportive, tell them when their results are going to be available, Honestly, if I can get the radiologist to come in, I will. Yeah, if it's a patient that is really worried and we can sense it, we will tell the radiologist, hey, could you go in and talk to them? And they will. And so I think it's trying to find that balance of giving them that reassurance that everything's going to be okay, how to get their results, and or just having one of our doctors come in and reassure them themselves as well.
How are things handled if you find something emergent?
Whenever we find something emergent, we call the referring physician's office. We relay those results verbally to a medical assistant, a nurse, a doctor at the facility, and document down that information. We don't want to see anything fall through the cracks. We want to make sure every patient's doctor's office is aware when we have some sort of critical finding.
So patients can rest assured that if something is found, you're talking to the radiologist, you're calling their doctor, they're going to be notified right away.
Exactly. And honestly, I do tell patients that, kind of going back to how you reassure them is, because they'll ask too, like, when is my doctor going to get these results? And I tell them, if there's anything emergent, your doctor's going to get those results today, like within the hour, hopefully, as long as they answer or call us back within the hour. And that definitely helps ease their mind.
How else can patients get their results?
We are very lucky to have a patient portal where patients can, from their smart device, their computer, they can log in, create an account with us, and just view their images and reports straight from there.
And so when we say view images, I do want to just touch on babies for a minute.
Yeah.
That if mamas-to-be are coming in, they're not going to walk away with the printout of images like you see on TV.
I know, yeah.
So talk to them for a minute and tell them how they can get to see their little one.
As time has gone on, we have, the printers have slowly become incompatible with our current machinery, and with everything going electronic, haven't really come out with anything that is an option. So we, all the images go over through the patient portal. You can log in, you can pick out whichever pictures you want, print them out in any way that you want. So it's really nice. It gives you access to have everything right there.
Some of the other questions that I know we get as we're talking about moms with babies is having family come in for the ultrasound, that first heartbeat, those first moments. Talk us through the experience for a mom-to-be when they come into SDMI for an OB ultrasound.
For OBs, we like to make sure that the technologists can be fully, dedicating their time and their mind to looking for anything abnormal with the fetus, finding all those critical things that we need to find. And then after we're complete with that, we will let the family members come back and kind of re-show them the big aha moments, right? Like the heartbeat, a little profile, maybe just seeing the baby move or wave. Sometimes you just have to sit there and wait and let the baby do its thing, and it will start, flipping around. And being able to provide that for someone is really important to us, but we want to also make sure that we are very focused during the didactic part of the exam. And so that's why we ask to kindly wait until the tech is done with the important, medical stuff, and then we'll have the fun after.
What is the biggest piece of advice that you could give to patients?
Be your advocate, do your homework, get second opinions. I think, sometimes, people don't take that extra step to know exactly, what their diagnosis is or what the treatment plans or options are. And doing that, I think, just really allows you to become more educated in the subject, and honestly will help ease your mind a lot as well. If you kind of know what to expect or what your options are, you feel more empowered when you make those decisions.
One final question for you that I've asked all of the SDMI team members, which is, what would your younger self be most proud of you for or most surprised by?
Just how far I've come. I mean, just, you know, from a girl in a small town in New York that, you know, cows were your best friend. No, I'm just kidding. To, you know, living in Las Vegas, you know, becoming the head of a department. Anything is possible. You put your mind to it and you put in the work, and don't be afraid to make mistakes. But yeah, just be a bit kinder to myself, I think, not so critical.
Awesome. Thank you so much for your time today.
Thanks, Danielle.